We all know that a flat backboard is simply not comfortable. For many patients, especially the elderly and those with chronic back problems, a backboard can seem like a torture rack. The semi-disposable fast splint makes an excellent padding device for a backboard. The large size fast splint pads the area from the head to the hips of most adult patients. Here's how it works. Place the large size fast splint on the backboard with the wide end at the head and the tapered end toward the foot. Remove a slight amount of air so the splint is like modeling clay with all the beads evened out. Now the splint can be easily held in place on the board during the log roll maneuver. The patient can be placed onto the fast splint backboard combination with little or no modification of your normal vehicle extrication process. After positioning the patient on the board, and before applying vacuum for the final fit, have a partner mold the top corners of the fast splint up around the patient's shoulders and head to form a snug head immobilizer. Now finish evacuating the splint with your hands holding both sides of the fast splint. Here's another streetwise tip. When you have evacuated about half the air from the splint, you can change the position of your hands up around the patient's head and use your thumbs to create ear channels in the now clay-like splint to make it easier for the patient to hear. The fast splint should be under the patient's head and should not extend over the top of the patient's head. Cradle the patient's head with your hands at the base of the head by the shoulders while you evacuate the air from the splint. You can now secure the patient with tape if desired. The polystyrene beads fill in the voids at the lumbar, thoracic, and cervical spine areas, then lock in place when the vacuum is applied. This provides custom-fit comfort, support, and motion restriction that a standard backboard and head blocks cannot provide. Unlike other padding techniques, you get a perfectly contoured fit for each individual patient, plus a head immobilizer in one simple low-cost device. This method is also much easier and faster than traditional padding techniques and head immobilization methods. You will also notice that the fast splint actually molds to any backboard, which enables the fast splint to be held securely in place during any patient transfer. If your pediatric vacuum splint or other pediatric immobilizer is not available, try using the fast splint as a pediatric immobilizer in conjunction with a standard backboard. Because of the anatomical differences between adults and children, the child's torso usually needs to be elevated so that their cervical spine remains in neutral alignment. Here's how to do it. Lay the fast splint on your backboard, just as we did for the head immobilizer application. Remember that depending on the patient's age, your patient may need more padding under the torso area than under their head. Now, spread out the beads to meet the needs of your pediatric patient. Place the patient on the fast splint according to your local medical protocols. Now, use your hands to mold the fast splint around the patient's head and shoulders, just as we did with the adult head immobilizer application. Now evacuate the splint and then secure the patient to the backboard. The fast splint, of course, also acts as an excellent thermal insulator, which is a real benefit when working with pediatric patients. The fast splint can be especially helpful when caring for a patient with a dislocated shoulder. Frequently, these patients are in extreme pain and are holding their injured arm in a position that causes them the least amount of discomfort. The next time you confront such an injury in the field, try the following technique. Evacuate a small amount of air out of the fast splint to make it feel like the consistency of modeling clay. Have your partner pose in the same position as the patient and then mold the EvacuSplint around your partner's arm. Here's a note. You can do this same type of preforming by using your own lower leg and foot. Now, transfer the fast splint to the patient and complete the molding around the patient's injured area. Now evacuate the fast splint with the pump or your suction device and secure the straps. It may be necessary to use a backboard strap around the torso of the patient. two fast splints can be nested together to form a longer splint for those rare occasions when a longer splint is needed. Here's how to do this. Place the smaller of the two splints inside the larger one. Now, while your partner provides support to the injured leg area, slide this new combination splint under the fracture site and position the splint where it is needed to provide sufficient support. Now evacuate the smaller of the two splints first, then follow with evacuating the larger one. This application is especially useful when trying to completely immobilize the entire leg and foot of a very tall person.